So next up is Tim Cawston. Tim is a very senior academic here in the Musculoskeletal Research Group, so we thought it was very apt that he would talk about the Ageing Centre of Excellence. He's going to give me a hard time about that later. Where are you, Tim? Tim Cawston.
Okay, well, I'm going to give him a hard time because he's just pinched my opening comment. So there we go. So yes, I'm in my 65th year, in fact, and so I'm going to start by giving you some statistics about people who are 65. This just actually shows you the proportion of people who are over 65 in the general population from 1950 to 2050. And I think you can see that around about 5% of the population, of the world population this is, in 1950, will grow to some 16% by projected the year 2050. Quite a big increase in the proportion of people who are over 65. More frighteningly, perhaps, in 1950 there were 9 people who were under 20 for each person who was over 65. It's projected that by 2025 there'll be less than 1 person who are under 20 for each person over 65. This is called demographics. There are huge changes that are occurring in the population of the world, and they have a real influence on what's happening. This just actually shows the kind of changes that occur, quite dramatic in the first 20 years of our life, from growing from this size up to a mature adult. Huge growth and development. For the next 20 or 30 years we tend not to grow up, but some of us tend to grow out. And then we actually find that we lose energy, and gradually we find it more difficult to do things that we found easy to do before. And there are huge changes that actually occur in our appearance. This just actually shows that the sort of changes that occur in our skin and in part of our skeleton as an individual ages from the age of about 40 through to 70 or 80. So huge changes that are occurring in the population, and we're all aware, or at least I'm aware, of the changes that occur in my musculoskeletal system as I age. Musculoskeletal disease forms a significant burden on the population and on health services. So this just actually shows you musculoskeletal disease here is the most common disease that causes problems in middle age, and it's only surpassed by heart disease as we get above 65. And if you just focus on the front graph here, it actually shows you in terms of arthritis and rheumatism, there's an age-dependent increase, which is more common in women than it is in men, in the blue, but it just shows you there's this increasing burden of chronic sickness that's caused by musculoskeletal conditions. And so around about 6 years ago, Arthritis Research UK organised a conference in Warwick where they got people from the UK to actually come together to actually discuss how we were actually going to understand the ageing processes that happen in all of us and how they impact on the musculoskeletal system. And they then put out a call for centres to actually put in, and we were fortunate to actually be successful in our bid for this centre. ARUK were really smart in the sense that they've gone to the MRC and said, why don't you partner us in this really important area? And they've managed to get MRC to put in 3/4 of the money, and ARUK are putting in 1/4. So our centre is actually between the Universities of Liverpool, Sheffield and Newcastle, And the reason for that is to try and get experts in all kinds of different fields to actually work together to try and understand this problem. So Liverpool has got a strong track record in terms of muscle research and ageing research. Newcastle in terms of cartilage and synovium and ageing research. And the University of Sheffield is really strong in bone. And so the idea here is to try and look at the whole musculoskeletal system, to look at the whole joint and try and understand all the tissues there and what is happening to each of those. Now in the past what's happened is that you tend to actually just focus on one tissue at a time, so we've focused on cartilage, but we don't actually sort of look at bone. This helps us to actually understand how each tissue is affected as we age. There are 5 work packages, and I'm very quickly going to just run through those to actually show you. So I want you to focus here as we run through the sequence on the changes that are occurring in cartilage. This is osteoarthritis, actually just showing profound changes that occur in cartilage, so that in the end we're actually down to denuded bone. Perhaps you can watch this time and actually just watch the bone underneath to see the changes that are occurring. So we've focused on cartilage in the past, but we understand that there are profound changes occurring in the bone, where the bone underneath thickens, the structure here actually changes quite markedly, and you get these cysts actually forming and cartilaginous implants in the bone. That's something that we've ignored in the past, but we're now in collaboration with Sheffield trying to understand the basic mechanisms that are going on not only in cartilage and bone, but also in the muscle and the ligaments surrounding the joint, to try and understand exactly what's happening. Because sometimes by treating a certain pathway in one tissue may adversely affect another, and we need to actually make sure we're looking at the joint as a whole. The second work package actually looks at measuring and monitoring changes in the musculoskeletal system, so they can either be blood tests, or they can also look at imaging of bone to actually see how much bone is disappearing. We actually look at how our motion is affected by actually just putting sensors on different joints and actually following them with a computer. And then there's a researcher in Liverpool who actually has a computer program to actually look at changes in skeletal structure with age. The third work package is actually looking at patient cohorts. We've already heard that Newcastle is strong. I'm just going to show you some results from the 85 plus study, where we recruited everybody who I think was born in 1921, I think this is right, into all the people who were born that year in Newcastle were recruited into this study. And when you look at the incidence of musculoskeletal disease, this is osteoarthritis, 65% of those 85-year-olds had osteoarthritis in one joint or more, and 13.5% of them had actually had a joint replacement. And as John has already said, there are other cohorts that we're actually able to look at and understand what's happening as we age. There are various models that we actually try and actually look at, so either looking at cells in culture or tissue grown in the laboratory. These are joints from looking at the cartilage in mice at 3 months, 6 months, 12 months, 24 months and 36 months, and you can follow the changes that are actually occurring in those joints over that time period. And the results from all these studies can actually be put into computer programs that actually tell you which pathways are involved in these different tissues. But the overall aim of what we're trying to do is to find ways in which we can intervene with people throughout their life to actually make sure that we live a healthy, productive life. And this can either be by actually modifying diet, so there'll be intervention studies that are beginning now that actually look at various dietary interventions, or coupling those with exercise as well to try and actually keep us moving, and also drugs. And I think the final slide just actually shows the overall mission of the centre of what we're trying to achieve, and I'll leave that up while we change the microphones for the next speaker and you can read that. Thank you.